So we're an intermittent bolus gravity feeding unit for the most part. It's very rare that we'll put a feeding on a pump. I do know there are many NICUs around the country exclusively feed on a pump over time. And then baby's tolerance, I think it seems more physiologic to have feedings going in a controlled way versus a pump generating the rate of the feeding, whether the baby is willing to accept that volume at that given time. So I'm not a fan of the continuous feed or the pump, but I know many units do use them.
So we are an all-pump bolus feeding unit. Very rarely do we do feedings over gravity, but we don't do continuous feeds either. So we don't have a lot of issues with clogged tubing, but obviously over a pump that helps a little bit. And we do actually flush our tubing after with different products depending upon what the baby is feeding. And that actually generates or helps with the clogged tubing as well. Haven't had any issues with that and feel like it works out pretty well. Manages the use of breast milk a little bit better for us. There's not overfill, there's nothing that's going on waste-wise with donor milk and mom's milk, that kind of stuff.
Agreed. We actually do a little of all. So we do some continuous, not very many. Most of it is going to be over a set amount of time, bolus, but and very small volumes will actually do the gravity. But again, because of the pump, we have not seen a lot of the clogging of tubes. And I agree. I think it's partly because of the pump that can push that volume through.
I think the orientation when you do decide you're going to feed on a pump, syringe orientation to maximize the delivery of the fat content, length of tubings is very important. The shorter the better. They shouldn't be coiled on the counter, and the shorter the feeding tube too. And I saw there's many nursing measures that can be done to help maximize and improve pump feeding and to maximize the caloric delivery.
So when we do our clearing of our tubes after enteral feedings, most often we use water. And it is really just enough to get through the tube to make sure that we don't have any residuals left over in the tubing. We will use air every once in a while on babies that we don't want them to have that extra fluid. But we definitely are looking toward figuring out exactly what the best answer is for that. And trying to make sure that we're not having any of that fat remain in the tubing.
Is that water then cleared out of that tubing before the next feeding, so
Correct.
It's not actually administered to the baby? Yeah, we use air for the most part. Now that we're using a lot of gentle respiratory techniques, such as CPAP and non-invasive ventilation, air bellies do affect sometimes, I think, our ability to decompress them with their tubes. And so what we're finding, because we have that tube open to gravity to allow that ventilation, that there's a lot moving up and down that tube continuously. So we really haven't seen a blocked tube. Also the size of the tube that you use. If you're using an incredibly small French tube, the smaller the tube, I think the more likely you could have something occluded.